I'm Chris Corcoran, and I am a board member at the ACT Mental Health Consumer Network. From my early teens, I had lived experience of depression and anxiety, and I often used self-medication to deal with that, although of course that wasn't a positive way to deal with it. Functioning alcoholic is a term that's often used. So I did really well. I got a master's degree in engineering, and I'd say I was very senior in a company here in Canberra. I was married, I had 3 kids, 2 dogs, beautiful house. But in 2013, things came to a head and I lost my career of over 30 years, primarily on medical grounds. There was the addiction, but I also discovered that I needed both my hips replacing, so there was a physical aspect to that as well. When things cleared up, when I stopped drinking, I would wake up and I'm like, oh, how is this my house? How is this my wife? How did I get here? I had no idea who I was, what my values were. So how could I know who my family were? And because I didn't know who I was, I couldn't really help myself, and therefore I couldn't help other members of my family or friends. Despite having a master's degree, I knew I didn't want to go back to engineering because it was a very toxic environment. I had no confidence to stand up for myself. I was very much a people pleaser. I kept on saying yes, even though I had no capacity to do things. And so I spent most of the time letting people down. Doing the self-advocacy course gave me my voice back. It allowed me to say, hold on a minute, I can say no. It means sticking up for myself respectfully, respecting my own boundaries, respecting the boundaries of others, and saying no and saying I can't do something is being respectful, because saying yes, I can do it, and then not doing it was really disrespectful. I always thought looking after myself was being selfish, but self-care is the most important thing that you can do. I got an opportunity to take a scholarship that the network promotes that allowed me to do Cert 4s in mental health and drug and alcohol. And then I did the consumer advocacy training and started representing consumers on committees, and that then led to me doing the co-facilitation training. So I then became a co-facilitator on the training rather than just a student. I then became an ordinary board member and then deputy chair. So initially I was working on a patient consumers experience committee and how ACT Health could improve that. So that was a good way of actually putting forward, well, going into the hospital made me feel like this. If you had done this, we might have felt more comfortable and more inclusive in the experience. I was able to use my engineering skills in some of the new hospital project. The concept of peer education and co-design around the fact that it's not that power differential that you get at university or a school. The people presenting the course are learning as much from the participants as the participants are learning from you. It's a very empowering model. The work with the network it helped me build up capacity to work. When I first started, I thought I was fine, and then I did a bit of work with the network and I suddenly realised, actually, I'm not ready for this. But it allowed me to do that in an environment that was safe. So it gave me time to rebuild that capacity. It gave me confidence to say, it built my resilience. And being on the board gave me some experience around governance, which is quite important in what I do now as well. It's actually been useful in terms of the work I'm doing now because I have those connections. A lot of it was self-confidence building, but a lot of the benefit I got from doing the co-facilitation was building up my own confidence. I think being involved in the network helped with my recovery journey by giving me the confidence to know that it wasn't going to happen quickly and to take it one day at a time, to accept that it wasn't going to be a linear progression, but the network allowed me to say, okay, it is what it is. Everyone has a voice. That would be the biggest takeaway I have from my involvement with the network. Systemic advocacy was something that was very alien to me. When I went into a committee, I was not representing myself, I was representing the consumers. And taking it a bit further up to policy level, systemic advocacy is really important because it's about, we can set the future. If you're not involved in it, it's not going to happen. I would encourage people to be involved in consumer representation because it's important for the consumers themselves to be advising policy and lawmakers and service providers about what they need individually and as a group. Nothing about us without us. I guess knowing that you're with people that have similar experiences, not necessarily exactly the same, but you've got shared circumstances, and makes me feel a bit more comfortable because I don't feel like I'm being judged. The network was the right place for me because it gave me a sense of belonging, sense of self. I think that's the big thing. It gave me that sense of self, which I'd lost for over 30 years.